Frontline healthcare workers are calling for a stay-at-home order in Ontario, including ICU doctors like Hamilton's Bram Roshwork.
In general, people don't appreciate what goes on in the hospital and the sadness and the loss of life and the critical illness in previously healthy people that we have. You can appeal to people, but I think these directives have to come centrally from government.
We'll discuss that tomorrow.
The Premier imposed no further restrictions today, although he recognized that last week's lockdown order was not entirely effective over Easter weekend.
You know, you go by Yorkdale, you couldn't get a parking space. You know, it was absolutely jam-packed. And I truly was hoping that, you know, people wouldn't be going in there to the volume that we saw. Folks, you know, this variant is taking off.
We now have the highest number of patients in ICU since the beginning of the pandemic. And this is posing significant risk to our healthcare system.
Provincial health officials say it takes time to craft a stay-at-home order, but Dr. Roshwork says ICUs are out of time, with increasingly younger and sicker patients.
I never thought we would get to 500 critically ill COVID patients in ICUs across the province. I never thought we'd get as high as our local numbers are right now. And we're still seeing 3,000 new cases a day across the province. And I know that the risk of those patients getting critically ill is a week or 10 days from now. So until we see that those numbers start going down, the impact in terms of ICU level care is felt a week or two later.
He thinks ICUs will manage over the next couple of weeks, but could still reach a point where doctors have to make decisions about which patients get care and which don't. Lisa Hepfner, CHCH News.